conversations, and therefore I had to come today.
Amazing, thank you. You have shared in the past that you've had a personal battle in the family, and Madam Sharmila Tagore, Madam, has also been very open about it. And would you want to share a little bit on that and your voice for, screening and early diagnosis?
Gee, absolutely. Actually in our family, especially my father's side, there was more heart disease, and especially male members succumbed to heart attacks at earlier than we would have preferred ages. And that's what my father was always worried about, what we were always concerned with. He in fact passed away of a lung disease. It was idiopathic pulmonary fibrosis, and that's when we suddenly thought, the lungs are also organs that we need to be concerned with, and our focus was entirely on the heart. Of course, things are connected. And my mother, always very health conscious, very fit, looked after her diet, looked after her nutrition, was not a smoker, and she developed a cough when it comes to her health. And she likes to go and have everything checked out meticulously. And sometimes coughs last a while. And even the doctor said there's nothing to worry about at all. But we'll do a CT scan, we'll do an X-ray. This was a few years ago, so now I think most of us know she's about 81. I'm not disclosing anything that she hasn't disclosed, but this was soon after COVID. And she went and had a CT scan, and they said there is a shadow, but 99.9% it's nothing. And when it comes to things like malignancy, cancer of the lung, it's impossible to know for sure unless we cut you open and do a biopsy. And I don't know if that's something that you would want to do. And in fact, she told the doctors that, please, I would like to be sure. And so we had the surgery, and she did all the tests that she had to do before the surgery to ensure that she was fit. And we didn't realize she also did a test that ensured that if a lobectomy was required, she would be able to withstand that. And we were sitting in the waiting room expecting them to come back and say, of course, it's nothing. But when they opened her up, they did come to us, my brother, myself, and my sister, and they said, it is malignant. It's in a very, very early stage, and we can get it all out. And that's what they did. They took a third of her lung out. She didn't require any chemotherapy or any radiation, any follow-up treatment. We were very, very, very lucky she was. And that was entirely because of the fact that she insisted, firstly on having the test done and then on having this biopsy done. The story has a happy ending, but I feel like for many people perhaps it goes in different ways. Some things you feel you have control over, some things you feel you don't have control over. But the one thing that we were very grateful for was the early screenings, was for a little bit of concern. A lot of people are paralyzed by the fear of what if. A lot of us, and that has nothing to do with our economic background, our educational background, nothing. All of us just feel like if we don't do the tests, maybe we won't find out, and maybe,
fear of finding out.
Fear of finding out. And I think that you must take it head on.